Hi guys, today we'll talk about infertility in males. Infertility is such a sensitive topic to talk about, and male infertility is no exception. As Africans, most of the time when there is an infertile couple, the first thing that runs through people's mind is that it has to be the lady. But statistics show that about 35% is due to female problems only, 30% is due to male problems only, 20% is due to combination of male and female problems, and 15% cannot be explained. That means that the ratio of male to female causes of infertility is 1:1, and it's almost the same. And so this topic is equally as important as factors for female infertility. So at this point, I would like to encourage all the guys out there to not get too anxious about testing. There is no harm in testing for this. Some of the causes of infertility include deficiencies in sperm formation, deficiencies in sperm concentration. There could also be deficiency in sperm transport, notably retrograde ejaculation, and this can be explained as semen moving in the opposite direction. Normally, the semen is supposed to come out of an opening through the penis, but in retrograde ejaculation, some of the semen finds its way into the bladder where urine is stored. This can be likened to a tap with water moving in the opposite direction of flow, if you can imagine that. There are some childhood urological diseases or surgeries which can also lead to infertility. These conditions include cryptorchidism, which is undescended testis, and it simply means that the testis hasn't migrated into the scrotum, and therefore you would find out that the scrotum is empty. The second is hypospadias, and this is the opening of the penis being found on the undersurface. Normally, it's supposed to be found at the tip of the penis, but this time it is found on the undersurface of the penis. With this condition, sometimes the sperms are not placed on the surface of the opening of the uterus. I know it sounds really technical at this point, but just bear with me and learn as much as you can. Some other causes include trauma to the testes or balls, or testicular torsion, and this is just the tightening or the knotting of the cord of the testis. Surgeries gone wrong, such as inguinal surgeries or hernias gone wrong, can also lead to infertility. Occupational exposure, and this is very important because those who work in very heated environments, high temperatures, are also at risk, or those who happen to sit in high temperatures or they put a lot of heat near their scrotum. Naturally, the scrotum is supposed to be at a temperature which is lower than the body temperature, so we have to be careful. Also, severe spinal cord injury leading to paralysis can cause infertility, in that the person might not be able to ejaculate, or there could be reduced sperm or semen quality. Testicular problems such as testicular failure in some syndromes can also lead to infertility. There could also be people who have cystic fibrosis, having absence of the vas deferens, could have hormonal problems, Down syndrome, chemotherapy, radiotherapy, anti-sperm antibodies. All these are important causes of infertility, and one must always question any of these if you think that you have some of these conditions or this symptom. Male infertility can be diagnosed quite easily with a semen analysis. Normally, semen is obtained through masturbation and put in a clean, dry, sterile container. This is normally done near the laboratory. So quite often you will have to abstain from sex for 2 to 3 days to get good results. Semen is obtained and analyzed for sperm count, morphology, quality, and other properties. Imaging studies such as ultrasound can be used. There are medications that can treat some causes of infertility in males. Please consult your urologist for expert advice. And I would also encourage all males who have problems with infertility or couples who are infertile to go and test. Smoking cigarettes and marijuana poses a lot of health risks, and male infertility is no exception. So I would encourage men who smoke to stop completely. Try to limit smoking. Other precautionary measures include trying not to put a lot of heat on your scrotum or expose your scrotum to a lot of heat. Try always to keep your scrotum cool, cooler than the body temperature. The use of anabolic steroids should be avoided in men, especially it's used in those who want to build a lot of body mass and muscle. So, for instance, men who like to gym or bodybuilders. Please do this the right way. Do not use medications. Achieve your goals naturally. Dietary supplementation with vitamins such as vitamin C and zinc are very good and can boost fertilities. Sometimes surgery can work. So surgery such as sperm retrieval techniques can be used to retrieve sperm and used for fertility treatments. So guys, we've come to the end of another educational session, and I just want to tell you that there is hope for every situation. Don't get discouraged. Go out there and get tested if you have problems with fertility. Be bold and find help. That is all for today. So, please do subscribe to my channel. Love it, like it, and please share this information. Thank you very much. I love you all. See you next time.